Welcome, I'm Dr. Rick Seguil, the founder of Herbal 411. I wanted to explain to you how I put together the COVID clinic. My patients at Herbal 411, I refer to them as warriors, I am very proud of. Most of my patients will really be committed to making lifestyle changes and investing in change to seek longevity and decrease disease. Now, even if I have a select bias towards healthy individuals or people that are wanting to change, I still had my patients that got sick. And in fact, this time in the pandemic, December of 2021, we are now dealing with an Omicron variant that is sweeping both vaccinated and unvaccinated individuals. My patients, I believe, are going to do fine. There is no template or cookie cutter algorithm to say everybody gets this set of medicines or everybody gets this set of vitamins and they'll all do great. In fact, I was talking to a lady in her 70s now who, she and her husband came down with the infection and she was worried about dying. And I always embrace the fact that no one can determine what's going to happen, but I do believe if you invest properly and if you take care of those weaknesses or symptoms that are particular to you, you should be able to do better than average. In fact, you should be able to sweep through your infection quickly. That depends on the person, depends on resources, depends on how many medical problems or comorbid conditions you have, and your age. For example, if you're interested in monoclonal antibodies, there are some hospitals in the state of Illinois and other states too that offer that IV therapy. The only problem is the places that offer this are getting inundated, and you have to have an appointment and you have to meet a criteria. Well, most hospitals are trying to sift through and slow down the herd that's coming to get monoclonal antibodies, because at this point in time, that's the only thing that the CDC can suggest. I do trust the governing bodies of the CDC, but sometimes the bureaucracy at high levels slows down or bogs down the process of finding solutions to individuals. At the country level and large organization level, it's important to have algorithms to treat everyone. But when it comes to the doctor-patient relationship, it's really those two people that are in the room that make the most difference. And when the visit starts with me, everything is dedicated to the one person that's in the room with me. The idea is that treatment plans should be personalized. And these are some of the ways that I determine who gets what kind of treatment. Usually entry level, I think everybody deserves vitamins. In fact, most Americans don't eat properly, and because of that, there will be nutritional deficiencies. Everyone knows that even if you live at the equator, you still can be low on vitamin D. Definitely in Chicago, this latitude is notorious for giving even my outdoor workers and construction guys and road crews low vitamin D levels. The evidence shows that vitamin deficiency, specifically vitamin D, is associated with bad outcomes as far as COVID infections and other diseases, influenza, diabetes, high blood pressure, heart attack, and cancer, just to name a few. So the first thing I usually will embrace is, which vitamins do you take? Are you taking the standard vitamins that should be suggested for boosting immunity? I suggest 5. Vitamin D, vitamin C, zinc, quercetin to get the zinc in, melatonin. And those are the starts. Now, everybody probably takes their own doses, and everybody probably takes a lot more than that, fish oil, turmeric, and a couple others. But during the time of a COVID infection, you're probably not going to be that hungry. In fact, you'll probably be nauseated, which I'll talk about here in a second. Because of that fact, I cut back on the pills that my patients have to take. Except for prescriptions, anything that's maintenance should be postponed, and we should just concentrate on the most vital vitamins as necessary, as necessitated by previous blood tests or the vitamin protocol that I have for COVID. Next is hydration and nutrition. Most of my patients definitely do not want to eat. And that's fine, because the average American has a BMI greater than 25, which is overweight/obese. I think we have a little bit of time before we go into quote-unquote starvation. However, when you switch over from not eating to burning your own stored fat, there will be a bit of an adaptive phase, and you're going to have a lot of symptoms that might magnify all the symptoms of COVID. So you might need some help in trying to change over to a fat burning machine instead of a carbohydrate burning machine. Now, if you don't know what that means, I'll put a link down below for videos I did on fat adaptation. Regardless of what you eat, you have to stay hydrated. When you get to a level of 3% or lower of dehydration, every symptom you have will be magnified, and you're not going to like it. At least from the time that you wake up until the time that dinner hits, you should be putting down as much fluid as possible. It's a little bit hard to force fluid down, so I like to flavor it. Whether it's Pellegrino, Airborne, Noon, or any other flavoring, I'd say go ahead and go for it. Flavor that fluid up, chill it down, and try to have a regular dose every hour so that you're urinating clear to light color. When you're urinating dark colored urine, that usually means you're not taking up enough fluid. Now, I always say stop at dinner time because I don't want you interfering with your sleep. If you continue to drink a lot of fluid into the evening hours, the likelihood is high that you're going to have to pee that off a few hours later. Sleep is very crucial. Having said that, because you are exposed to COVID and sick, you really shouldn't be going out and exposing anybody else. If you are exposed and there are others in the house, please don't assume that they're positive. Assume that they're negative, mask up, and keep your distance. And even though you might have a small apartment or you might live in a studio, I do have a video on how to separate the studio so you don't go stir crazy or get bored inside your house. But at least if you wait until the 5-day mark and then have the other people that are in your house or exposed get their tests, if they're negative, they can probably proceed out into the community. If they're vaccinated, if you have somebody in the house that's not vaccinated, they have to wait 10 days and then they can get tested. As much as possible, protect the community. Vaccines are very important. In 2020, the surge in the United States started with New York, and it was spooky. One thing is for sure, in the United States, when it started to surge, soon after that, when the Emergency Authorization Act came into play and vaccinations were forced, the surge went down. And there are people who are anti-vaxxers, and I honor that. But one cannot deny that with the surge that occurred and then the downslope that happened to match the release of the vaccines, there must have been something good with the vaccines. And the data on the vaccines was very strong with regards to what they did. The efficacy was to decrease the severity of the infection, and it worked. It does not protect you long-term, though, and it does not treat an acute infection. Thus, there's nothing else that you can do except for monoclonal antibodies as approved by the CDC. Now, there are some off-label use medicines that have been rumored to help. Initially in Italy, there was the use of hydroxychloroquine and Z-Pak or azithromycin. I think the data was okay for hydroxychloroquine, but it was being taken away from those folks who needed it, mostly patients with autoimmune disease and SLE. And it didn't really pan out. The Z-Pak did help a little bit. I think it made a difference, but perhaps that could have been because those folks with COVID also had a secondary bacterial infection. And I continue to use Z-Pak for bacterial infections. The question is whether you can use Z-Pak for COVID pneumonia. And number one, it won't hurt because the side effects are low. Number two, there is no other treatment plan. So the theory of using repurposed drugs is strong because there's nothing else available. But you have to be smart. The doctor and the patient have to make a decision together. There is controversial use of ivermectin and another medicine called Fluvox or fluvoxamine that I think mechanistically have proven helpful. Until we get peer-reviewed data in a couple years, we'll never know. But as long as there's no harm done, I think it's worth it because there's no other treatment. There was an astute doctor out of Texas that was starting to load his patients with budesonide, an oral steroid that you inhale. And he supposedly was having great results with beating the COVID lung or the coughing that was associated with COVID. If you remember, when the virus first came out and research was being conducted on it, we initially found that it was being attached to the receptor called an ACE2 receptor found mostly in the lung. But that was just the entry point. Nose, mouth, and lung. We found much more data that it's probably going to be a vascular-derived virus that attacks the vascular bed. That means a blood vessel bed. But budesonide seemed to help those patients, and I still say that it's helpful with patients who previously had asthma or patients without asthma that are just coughing and having difficulty with breathing, especially if they have COVID pneumonia. Budesonide is very tough to find, and it's very expensive, but I can give it in nebulizer form if you're willing to pay. I've found several pharmacies that will give a nebulizer for approximately $70, and most insurances will cover budesonide, the ampules that you put into the nebulizer. If not, GoodRx is such a lifesaver that they do give a coupon for a discounted rate. Finally, other options are the use of prescription medicines for the symptoms of COVID. Infections, antibiotics, especially if they're bacterial. You can get secondary infections because your immune system is down, and you might get a pneumonia, bronchitis, sinus infection, maybe even a urinary tract infection, so you might need antibiotics. Anti-nausea medicines like ondansetron, also known as Zofran, are fantastic. A lot of people will have cough, 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 and vomit or nausea, or just nausea from the cytokine storm. Zofran's a lifesaver, especially if you're trying to take in fluids and you can't because you feel like you have to throw up. The nausea pill, which is commonly used in little kids who have chemotherapy, is great, low side effects, and again, there's nothing else to treat COVID. Mood medicine, as I mentioned before, the repurposed fluvoxamine is actually an antidepressant, but it was found mechanistically to help COVID and also to help your mood. I have a lot of patients that are stuck in the house. They can't get out, they become depressed or anxious, and it does help them to get on an extra medicine for a short run. Fever control is very important. If you look at the data before, everybody said don't touch your fever because it helps with fighting the infection. Well, that's true, but if you're burning a temperature of 101, 103, if you've ever had that high of a temperature, that is uncomfortable. And because of that feeling, no one wants to move, no one wants to eat, no one can sleep. And that's interruptive of daily activity. So I think it is worth it to treat a fever that's uncomfortable. If it's tough, I would say Tylenol. I don't really like Motrin because people are already nauseated. So using Motrin will have a tendency to control fever and pain, but it can cause irritation of the stomach, whereas Tylenol doesn't do that. Pain control can be in the form of Tylenol or Motrin or Tramadol. Sometimes prescription pain medicines are necessary. Finally, sleep has to be maintained, and I might give a prescription medicine, I might not. I might give an herb, I might not. But again, that's the beauty of the COVID clinic. We personalize the medicines and the plans to match the one that's in the room with us. I will always look at and consider the protocols established by the government, but it's up to me to put together a personal program for you and your family. Regardless of whether you come to the COVID clinic or not, please stay safe, get rid of your comorbid conditions, and stay healthy. Thanks for watching.